Okay, 37.8 degrees. Hi everybody, it's Matt and Don. Welcome back to OK Aussie. It is Sunday, the 22nd of February, 6:37. You can see the ice pack. Diane's been struggling with neck pain. Her right patella was just out, so I've just relocated that. She's just started to go offline, not feeling terribly comfortable. Put pulse oximetry on, and as you can see, we've actually just hit 91% oxygen saturation, heart rate's 59. So I need to get a blood pressure, I need to get the bed back down level. So we'll bring the lower part of the bed down, and we'll get a blood pressure reading and see what's going on. (102/70), 58 heart rate. Now, Diane has struggled with sleep initiation and quality sleep over the last couple of days. Her fever has been running high. In fact, early this morning we still got 38.1, so temperatures are running high. She's got infections, multiple locations that we're trying to deal with: chlorotic for the eyes, UTI, trimethoprim. She's had a lovely pop-in visit from neighbours down the hallway today. They stayed for about 40 minutes or so, had a cup of tea and a yarn, but that, I think, post-exertional malaise has tipped her over into the fatigue part. We couldn't control because we hadn't had it scheduled, and you can't always push back. So I think that's been too much to chip Diane over. New to the channel, welcome. Don't forget to subscribe, hit that notification bell. Diane is a person with a rare genetic chromosomal condition called 22q, 11.2 deletion syndrome. It's a microdeletion on the long arm of the 22nd chromosome. She's missing between 30 to 50 genes, 3 million DNA building blocks, and that equates to anywhere up to 185 clinical symptoms. Diane's in a state of syncope at the moment. Some guttural indications of pain. Just going to remove the ice. She's been trying to deal with the CCI, cranial cervical instability, and the pains that have been issued from that, just using the hot cold pack. Now, at the same time, she's actually got the hot pack on her lower body, and that's operational at the moment. Oxygen sets at 95% saturation, heart rate is 59. Feet are very warm for her, which is unusual. Both feet are slightly inturned, so I'm expecting to see some segmented cranial dystonia, maybe some orthostatic intolerance. I'm hoping that this doesn't proceed into a mixed mode neurological with seizures. But at the moment, I'd say that the blepharospasm is controlling the eyes. Some lip smacking motorations that are going on. Oxygen stats at 94%. Heart rate is 60. Now the room temperature is a perfect 24, which is what we're trying to keep it at always. So that's consistent at the moment. Outside's 22, so we're actually having one of the cool dips at the moment in between our summer here in Perth, Western Australia. We're expecting it to ramp back up into the warmer 36, 38 degrees in the next few days, but at the moment we've got a cool spell, so that's a good thing. Looks like she's just dislocated her right shoulder again. Diane's got a ongoing subluxional dislocation of the left glenohumeral joint, the shoulder. She is hypermobile with Ehlers-Danlos. She's popping all the time, so like I said, I just have to relocate her right knee. Knee dislocations, patellar dislocations are quite common with patients with 22q specifically, as is the overall hypermobility of Ehlers-Danlos. Currently 6:46 p.m. Obviously Diane's eyes shouldn't be closed. She shouldn't be wanting to simply fall asleep, so this is abnormal. An increased susceptibility for having seizures, in fact 7 times more likelihood than the general population with patients with 22q 11.2 deletion syndrome. In fact, about 65% of patients with that condition will have seizures and seizure-like conditions. 8.3% will have epilepsy. There's a whole raft of conditions, up to 185 clinical symptoms, underneath the umbrella term: autism, ADHD, OCD, Tourette's, seizure conditions, scoliosis, hypermobility, neutropenia, autoimmune conditions, GI tract dysmotility. The list just goes on. You're feeling hot? Heart. 96% oxygen saturation. Heart rate is currently 59 BPM. Are you getting continual chest pain, sweetie? You're getting flutters, are you? Atrial fibrillation. Do you need spray? I'm happy to try spray at the moment, sweetie, for you. Sorry? Yes? Communication in this phase is actually quite difficult, obviously. Nitrolingual spray, GTN, 652. Open up, sweetie. Still not getting it. Can you get in again? I need your mouth open, Papa. You feel it? It's yucky. I'm sorry, it's yucky, sweet pea. 6:53 p.m. You have any headache at all, sweetie? The sudden drop in heart rate equated also to syncope. So normally when we get a sudden drop between about 15 BPMs, when she goes offline, it tends to coincide with syncope, lack of oxygen blood flow that's going through to the brain. Oxygen flow is currently at 92% saturation. Heart rate is at 75 BPM with an increase. 91 is where the oxygen level is just hitting 90% saturation at the moment. I do feel that we're going to have a seizure coming on. We just don't really know. It's mixed mode neurology, just bouncing back up to 91% saturation. This is what we have to deal with. Guess and test, but obviously maintain monitoring and be ready. So I'm just going to get the oxygen concentrator ready just in case. We'll actually be picking up the new oxygen concentrator. It's a better model that the NDIS has now acquired for Diane, because the NDIS, National Disability Insurance Scheme, recognises Diane's need to have medical oxygen at home. It's the actual health department that's failed to provide oxygen cylinders, so at least the NDIS has stepped up in their duty of care to provision of that. So I picked that up on Tuesday. Okay, so hypersalivation and dribbling. Unfortunately, you're losing control of those muscles that contain the fluid inside. And also hypersalivation is quite common as pre-ictal into seizures. So as I said, we're on standby, waiting to see. It's measuring the level of rigidity which appears to start to build up in the left leg at the moment for Diane, so likely to be seeing some focal dystonia. We start to indicate and see what's going to potentially happen and the routines and the patterns that Diane's experiencing. If it progresses, then we'll obviously step in with some medical assistance providing medication. Now, of course, we have a flowchart that we run by. That whole flowchart approach looks at different levels. That's why we use the pulse oximetry. She's currently at 92% saturation. If she goes below 90%, then I'll apply the oxygen concentrator. We also have things like a defibrillator in case we actually need that at any point in time. These are the things that we have ready, but there are a series of medications in a flowchart approach that we'll use at certain thresholds and at certain times and escalate if we need to. Now, unfortunately, Diane had seizures, dystonia and Tourette severity yesterday. That was in a shower situation with orthostatic crash. Her heart rate, I think, got up to 148 BPM during that particular episode. Remembering that her resting heart rate's normally around about 52, 55 BPM on the regular. Blood pressure is very low, so she's normally bradycardic with that. However, she's trying to be clearing out her bowel. She's got dysmotility of the GI tract, gastroparesis. So the bowel medication is fluctuating, causing ripples with the heart. Changes in the chemistry of the body. It's also affecting the absorption of the medication. She's still just sitting on 91% saturation. Now, normally we want to see patients 97, 98%, definitely above 95%. That's when it goes below 95, we go, okay, what's going on and why? You okay, sweetie? Do you need anything? Just the rigidity and the stretching out that she is actually doing. Laboured breathing. This is seizure activity that we're actually experiencing here. We've got chorea happening with the legs in a gentle rhythmical motion. She's in a roll position. We've got some struggle with the upper torso. Oxygen stats are at 91%, heart rate's at 72 BPM. %, 86% oxygen. So as you can see here, we're going down below. Now, it'd be nice if your alarms were working. Why the fuck not? God, I'm sick of these devices when they don't actually work properly. Alright, 89%. So we're now just hitting it with medical oxygen because she's doing this. So we need to get that set up and running. Come on, sweetie, I need you back here. Sorry. I'm going to help you out in a moment. That's oxygen at 85% saturation at the moment. So just so you can see what we're looking at. So oxygen levels are at 87, heart rate had dropped down below 50, it's come back up now to 58. So that's where we're at for those readings. Thresholds changed, that's why. So she must have bumped the actual device and changed the threshold level. So that's really concerning. It's 84% now. 83% saturation. We're increasing throughput. So we're going to pump that up. Unfortunately, we don't have medical oxygen cylinders with the proper setup like I mentioned, which is what we should have in a situation like this. This is going to give some temporary relief, but not the ideal. Right. Careful not with dislocated arm. Slow your breathing, Papa. So throughput's at a level 4. What's the maximum throughput on this particular device? That's why we're waiting to get hold of the newer device as we come through. It's improved for oxygenation at the moment, but we need that. Heart rate is at 61 BPM. Oh my God, what's happening? Now, Dawn's had all her normal night medications. She's actually due for CBD. But we're actually going to now need to consider seizure medications and see what else is going into the mix. Hey? You feel sick, do you? Okay. Oxygen levels are at 88, 87. Alright, kid, I'm going to give you some anti-nausea. So, on Danzatron, 4 milligrams, coming in, popping it in. Good girl. So, on Danzatron, 4 milligrams, sublingual, 7:02 PM. Oxygen's pumping at full volume at the moment through a nasal cannula. You're doing really well, kid. With me, you can feel my hand on your back. I need you to fill up with big deep breaths. Getting big deep breaths right from the bottom, please.
Can't breathe.
Yes, you can. You're okay. You're okay. You're okay. You're doing okay. Okay, so we've got dystonia. I'm going to have to actually engage the medication for dystonia right now. Move, Max. Sorry, buddy. It's alright, Maxie boy, we've got none. Heart rate is 74 BPM inclining. Oxygen stats are at 96%, level 4 throughput at the moment. She's got oromandibular and blepharospasm, segmented cranial dystonia. I'd say the dystonia of turrets and seizure occurring currently now. Hey Google, set timer, 10 minutes. The dystonia is engaging with the esophageal muscles, plus obviously probably the breathing muscles involving with the intercostals and diaphragm.
10 minutes, and we're starting now.
Oh, get this bloody lid off. Slow your breathing down, kiddo. Come on, you're doing really well. Move, Maxie. Oxygen saturation 94%, heart rate's dropped down to 63 BPM. Why do I need to make stupid lids? I do not know. Okay, let's try this. Here we go. Coming in. Equal. Left split. Right split. Smooth juice. Right. 1 ml Rubitril. Equivalent 2.5 milligrams clonazepam applied. 7:05. Hey Google. Set timer. 20 minutes. Clonazepam. Hey Google. Set timer. 20 minutes.
All right.
Clonazepam.
Sorry, how long?
20 minutes.
Second time for 20 minutes. Starting now.
Off this. Okay, get it that way. Forward with your chin. Okay. Oxygen sets at 95%. We're on level 4 throughput still. Heart rate's accelerated, indicating it was seizure behavior. 81 BPM currently. Oxygen sets are at 90%. Level 4 throughput still. Ring Madaz, she's still in seizure. 90% saturation. Heart rate is accelerated 92. So 91. Midazolam 5 milligrams per mil. 707. Buccal split left right. So right now. Slow your breathing. Okay, I need that. I need that full enough. Okay. Alright. Some discharge. Okay, you. What the fuck? Now. No. This is not when you break down oxygen. No fucking way. Line lead. Line in. What the fuck? Oh, come on, machine. You've got a couple more days. You just need to work. Just your throughput level in case you're overheating. Alright, get in. Hey Google, set timer, 10 minutes, midazolam.
Third timer for 10 minutes. And we're starting now.
Good go. Hey Google, show all timers.
You have 3 timers. The 10-minute timer is running with 5 minutes and 54 seconds.
Okay. Let's maintain the 2 timers so we can see what's going on there. Oxygen throughput's on 3. We're equivalent of 98%, so I'm going to bring it down to level 2 throughput and see if she can sustain. Heart rate 67. You're doing really well, girl. I'm right here. This is the bad one. It's okay. So I haven't had the oxygen machine ever do that before, but it literally carked itself and rebooted. Had to actually reinitiate. We've got currently levels 93% saturation. That's on a level 2 throughput. Heart rate 79. Sorry, Maxie. You ain't helping me. No bother. You're there. I'm right here for you, okay? It's alright. Oxygen sex 96, heart rate 77. I can feel the dystonia through the back of the trapezius muscles coming through into the rib. So I'm feeling around the intercostal. So this is what's happening, unfortunately, struggling with both breathing and swallowing. So it'll be affecting her dysphagia. What's going on? Hand. I don't have an indication she can't communicate to me in this phase. Now we've given her obviously muscle relaxant, which is the clonazepam, which will hopefully help ease off the dystonia. We've given her midazolam, which will help stop the seizures. We've given her anti-nausea. Come on, girl, you're doing so well. Stick with me here. Oxygen stats at 93. Need to increase throughput. Level 3 throughput increase to. Heart rate is 77. Come on, I need deeper respiration from you, please. That's it, come on. and fill my hand to try and push through it. That's go. You're so brave. Movie. Oxygen stats. Increasing throughput to level 4. Just trying to pump the air in. Alright, that's increased a little bit. That's great. Bringing you back up to 95% sats. Hi, Maxie. Stay close, Maxie. Don't get up into trouble. No, you're not jumping up there. At the end of the bed, buddy. Reducing throughput to level 3. I'm just trying to make sure this motor doesn't burn out or anything stupid while I'm using it. Hey, hey. Sweet pea, I need you to slow your breathing down. I need you to slow your breathing down. Come on. Come on. Slow deep breaths for me, Kim. You feel my hand on your tummy, try and push my hand away. Oromandibular activity in the face is still going with segmented cranial dystonia, same as the blepharospasms. It's not affecting any focalized dystonia, just up the upper tract. So, like I said, trapezius, intercostal, abdominal, probably diaphragm. That's a go. It's okay. It's okay. You're doing okay. Oxygen stats to 92, increasing throughput to level 4. Heart rate is 64 BPM. It's currently 7:13 PM. I know, seizures will reduce, sweetie. Now, I'm not sure with any expulsion with the fluid loss that the midazolam has been as fully effective therapeutically as I need it to be, so I have to be ready to provide secondary midazolam if that's the case, with the assumption that she's lost it through oral exclusion. It's okay. You're doing so well, kid, and I'm right here up again. 94% oxygen saturation, level 4 throughput. Heart rate is accelerating again, 81, 82. Come on. Hey, darling. Hey, darling girl. Come on. Oh, sweet pea. I've got you. This is going to pass me. Shoulder. What's wrong with it? Hand, fingers. Shoulder. What do you need? Don't know what you need, darling girl. Hey Google, stop. Heart. Diane, is that what you're feeling? Is heart? You want heart spray? Heart is at 73 BPM. Oxygen sats are at 94. Preparing more GTN spray in case we need that. She's trying to communicate. I can't tell what. I'm not going to give anything that I don't know about unless I can get better indicators. Oxygen sats are 94%. Heart rate is 60, so heart rate is dropping down. So any rhythmic activity should be reduced. She's not tacky. Hey Max, come on. Right, reducing throughput to level 3. Reducing throughput to level 2. I need you on your back. What are you doing, sweet pea? Just tracing. This doesn't come with a manual, so we have to work this out. I've got you. You're doing okay, darling girl. Levels are fine. Levels are fine. You're going to be okay. This is going to pass very shortly. So, midazolam timer has concluded. chest is okay. Your heart is okay. Your breathing's coming back online. Okay, it's all coming back online. Gotcha. You're okay. Okay, blepharospasms will release very shortly now. Medication's working. Alright, doing okay. Oxygen stats are at 92%, 93% saturation, increasing throughput. Heart rate is at 67. Hey sweetie, I'm right here. Hello. First time coming around cognizantly. I'm right here. I need some communication from you, things that you might need. Do you have any chest pain done at all? You've been dribbling a lot. It's okay. You've also had 2 lots of medications. You've been doing dystonia and seizures and syncope, and your oxygen has been low. Do you have any chest pain? Focus on me. Focus on me. Do you have any chest pain, Diane? No? Good girl. Do you have any head pain, Diane? It's okay, sweet. You're doing okay. It's okay. It's alright, gorgeous girl. This is nearly finished. It's nearly finished. It's nearly finished, beautiful. Okay, it's nearly finished. The medication's kicking in. Alright. You're doing okay. You're doing okay. Reducing down to level 3 throughput. Oxygen concentrator. Heart rate's at 60 BPM. Hello, darling. Hello, beautiful. Hey, sweetie. Jesus was here? Of course he's here. He's always here for us, sweetie. He's helping me to help you. Alright? We've got you on this. We've got you. Okay, you're doing okay. I've got you, I promise you. You've still got some blepharospasm activity and mandibular. It's going to feel a bit funny in your face. The medications are kicking through. I know you're cold, sweetie, but you're actually running a temperature. It's currently 24.4 in the room at the moment, and we've got 6 minutes left on this countdown timer. That's for the clonazepam. The midazolam should always work, so the seizure should be terminated. I'm going to bring you up a little bit. I'm also going to place a pillow into play. Here we go. There we go. Line is good. Okay, I'm going to bring blanket up for you. It's alright. It's okay. It's okay. There you go. It's okay. Okay, we're starting to see the oxygen spike up now, finally. So it's been very low. Heart rate stable. You want some water? Give me 2 seconds. Give me 2 seconds. And I'll put the straw in the water. Okay, let's do this together. It's okay. Fill the straw. Fill the straw. Let's go. It's alright. Now you're dripping. It's alright. It's okay. It's okay. And now if it feels uncomfortable, I'll need you on your back for a moment. Oxygen levels are at 96% saturation. Great. Heart rate 72. Great. I need to give you some sleepy dip. Sorry about that. Say Okay, screw on for me. 0.5 mils, CBD THC, 10-10 combination. It's 7:22 p.m. So stay there in that position for me. Okay, sweet pea, what do we need? Hello. Now, you've still got blepharospasm, so the dystonia is still in place at the moment, okay? It's still alleviating. The seizures have stopped. Do you have any nausea, Diane?
No.
Okay, so no nausea. Seizures have stopped. I know that's a bit tight. I'm going to reduce that down to level 1 finally because the oxygen is stabilising. As you're coming around. Hey, darling, go. I need that nearby, please. Do you have any pain at all, Diane?
Yeah.
In your hips. Maxie, what are you doing? Okay, bit of a click there. Bit of a click there. How bad do the hips feel? Maxie, cuddle mum. How bad do the hips feel, sweet pea? Average. Now checking the oxygen levels and see whether we can take that off. Yawns, first off, 724, nice and deep, thank you. So that's what I want to see. They're, for me, the visual indicators of conclusions of seizure behaviour. So that tells me we don't need to engage further with midazolam. That's great, but she's still got a minute 13 left on that 20-minute countdown timer for the clonazepam.
Ew.
It's okay, we'll change things out. Alright? It's okay.
My feelers wet.
It's okay, sweetie. We'll change things out. Not a big deal. Alright? That's a nothing problem in the world, isn't it? Oxygen stats are at 95% saturation, heart rate 69. I'm just going to actually disengage the oxygen concentrator, see if she can sustain these levels. Welcome back, welcome back, welcome back. Yeah, big yeah. Yeah, it feels actually like it's being a bit warm in here, but it's actually 23.4, so that's the opposite to what I'm feeling. Maybe I'm just running a sweat too after all that running around. Takes a bit out of me too. Alright, let's have a look. Oxygen stats are sustained. They're staying at 96% saturation without oxygen concentrate. Great. Heart rate 66. Hey Google, stop. I haven't removed the nasal cannula for the oxygen because just because I've turned the oxygen off doesn't mean it's going to magically be okay. She's just dropped down back to 92%, so I'm just seeing if she's going to restabilize. Obviously, if she hits 90%, then I'm going to flick the oxygen back on and we'll keep that going. But I'm just looking to see how she's stabilizing or not without oxygen. That's why we keep the cannula in place. She's staying at 93. Sorry, but I'm introducing oxygen again.
I can't breathe.
You can breathe, Bubba. You're doing perfectly fine. Oh, gotcha. Now.
Yeah. Where's he gone? Say something.
Do you have any pain in your chest at all, sweetie? In your tummy?
No, I had tight.
You had tight chest before, did you?
Tight.
Okay, so that's reduced. The blepharospasm is still there. You're not fully released of the dystonia. Second of the major yawn, so I'm happy with that. I'm keeping that countdown going. Oxygen stats are at 95%. That's on a level 2 throughput, so she's still not self-sustaining her oxygen levels at this stage. Really? Do you want another sip of drink? Do you need another sip of drink? Yeah? Okay, let's go for the water again. go. Currently 7:28 p.m. It is Sunday the 22nd of February. 21 degrees outside. 23.6 inside. Oxygen levels are at 92% saturation. Far out, dude. You need to stop moving your brain. So I need to keep this in alignment. Otherwise I'm going to have to take it down into this spot. It only works if it's in, right? Deep breaths. I need you to work. I can't do all the work for you. That's it. That's what I need. Yes, it'll trigger another yawn. I think that's number 4. Better oxygen level. I want deep breaths from you. Come on, you can work those muscles. I don't care if you're tired. Sorry, I'm going to be a pain in the neck. Come on, with me. Come on. Good girl. No, not too bad, we're just getting fun. It's probably being hyper flexible too. Alright, oxygen levels at 97. I'm going to bring you down to a level 2 throughput. Now, we've given you medication for nausea. You're saying that you've got no more nausea. You've had emergency ASM anti-seizure medication midazolam for the seizures. That's terminated the seizures, so happy campers there. You've had some Rivotril, which is a clonazepam muscle relaxant, and that's starting to ease up on the dystonia. It's taking a little bit longer this time to break through. So it's easing, I can see, but it's longer than the normal 20 minutes. That's okay, you'll get there. We're giving you some medicinal CBD THC, that'll help as well. You're feeling a bit itchy. Now, Diane, just inside your mouth, teeth, lips, cheek. You can't feel at the moment. Right, let's get a torch. Let's find out another of the deep yawns. That's great. Eyes open up again for me. Let's have a quick look inside, please. Okay, I need to see your mouth, please. Alright, good. You look okay. About 30-35% of patients, when they're having seizure-like conditions, can actually bite the inside of the mouth, lips and or tongue. Luckily in this case she hasn't. There's been a lot of hypersalivation, dribbling, nausea. Lucky that didn't lead into aspiration, and that's why we kept her in the recovery position during those peak sort of periods of time. Oxygen starts at 90% as she drops out. Come on, I need deep yawns, big breaths. Let's go. Don't know why your oxygen levels are so flatlining for me today. Heart rate's at 69 BPM. Yeah, I'm not surprised you're not getting enough oxygen to your brain at the moment, kiddo. Yeah, it doesn't help at all. Alright, it's doing better now. Keep breathing nice and deep. That's the only thing I need you focusing on this. Nice deep breaths for me, please. Here she comes. No, well, I need you awake. Changing the air conditioning. Come on, stay with me. Are you better now? Well, I think A, the seizures is definitely finished. The dystonia is starting to ease up more and more, but I'm still not getting a total clarity around your eye and eyelids at the moment. That's the last one. The yawns are through. I think it's about 6, so we definitely know that that part's fine. Your pain is fine, your nausea is fine. Have you? That'll be from Maximus. He's been up here trying to help you. Max? Oh, well, you can come and help too, buddy. Let's just get an update on the old blood pressure and see where things are at.
No.
Yeah. And I also need to check your temperature. Oh, you two ratbags, what are you up to now? Hmm? I'm sure Max is up to something. Hey, darling, and it's been a hard one for you, okay? You've been pushed over the edge. Yep, you had difficulties breathing. That is correct. I saw that. Your oxygen saturation levels were down to about 82%. Just relax for me. I'm just going to take a blood pressure. You feel a bit of a squeeze of your right arm starting now. Oxygen stats at the moment are 95% saturation. Heart rate is 64 BPM. I know, it's not very comfortable. It's just going to be a gentle squeeze. It's currently 7:34 PM. Max, you look like you're about to do something naughty. Just relax, don't move please. 101/65, heart rate is 60. Max is in the tower. He's giving Willow the shits at the moment, saying, "Hey Willow, I'm taking over the tower." No, you can't reach over them at the moment. It's really well under your range and you're not moving at the moment. I'm going to take your temperature and see whether your temperature has adjusted at all. Oxygen sats are at 92% saturation, bringing the level up to level 3 throughput. No, well unfortunately we shouldn't have obviously had people allowed in today because it was too much for you on top of it all. Alright, that's all good. Let's have a look just to make sure balanced. Okay, so your below 37.4, so you're certainly coming down a little bit. You want Panadol? No, you've had 2 today. I know, I agree. I understand that. Yeah, there's a lot that you have to deal with. I get it. Now, I don't need this. I need you just to relax and deep breathe. I need to focus only on the breathing. Sorry, we haven't got time. I'm going to help you to help yourself here at this stage. 7:36. You're doing your best you can. Deep breaths, kitten. Otherwise, I need to make some more medical choices at the moment. Good girl. You're doing really well. Doing really well. No, no. It's okay. I don't need you dislocating your arm, sweetie. I know you're frustrated. It's okay to be frustrated, but we don't cause more problems for our body. That's it. Slow it down. I need your heart rate to slow down. Thank you. Good girl. I'm so proud of you. I know you have to do a lot. Is your tummy sore? Okay. Now the other exacerbator of this, like I mentioned, was obviously the gastroparesis and the medications for dysmotility to actually try and improve process and get things going. It sets off, it affects the heart, it causes more arrhythmia, regulate. It changes the balance of the electrolyte function and Diane's chemistry set goes offline. It causes intense pain and that can be an exacerbator and trigger into these things as well, particularly vasovagal. What's this? That's your nasal cannula. I'm actually going to bring it down a level. And if you can breathe really well for me, I'm going to take it off, but it's your job to breathe. Love the yawns. I think we're up to number 8. I've lost count. I hope you guys have been helping me through on this, because I haven't got eyes in the back of my head. I can't see it all. Come on, more of those. You've got this. I'm going to bring you down to a level 1 throughput. Yep, you're doing so much better. I'm just turning the device off and I'm just going to see for a minute, but I need you to work your lungs. I know you are, kid. I know you're trying super hard every day. You wake up and you try. This must have been a little bit painful for you today. Okay, I can see that the dystonia was engaging a lot with the oromotor function. You were dribbling, releasing fluids more than you ever have. Okay, so it's quite unusual. Hypersalivation is a normal thing, but the levels of what you were doing, flannel's right here. Would you like it? There he goes. Would you like a sip of water? Yeah? No worries. Now, for the moment, I need you not to talk, but just to breathe. I've just got to get these levels back up. So that's the only thing we're focusing on. It's you and me. We're the team. Oh, I know, sorry. I just need to bring that up to bring your blood pressure and your heart rate up and then come up a little bit more.
You're naughty, Max.
Max, he's being a tease, isn't he, at the moment? You got that? Good gal. Good job. I think Max is doing well at the moment.
Cuddle, mommy.
He's jumped to my bedside table. Keep the deep breathing going. Your oxygen levels are at 93%. I need better. It's okay. It is tiring. I get it. Yes, you can. I don't need you crying. I need you breathing. It's the only thing I need you focusing on right now. You're doing your best. That's it. You're sustaining. You're doing well. Come on. Keep it going. I know it's tiring, kitten. Come on. Stay with me. Don't pass out. Done. Hey, done. Diane. Hello. Back on. Back on schedule. You getting chest pain again? Hey, Don. Hey, sweetie. I know you're tired. I need you to wake up. I'm sorry. Come on. We're not sustaining oxygen. Oxygen's at 91% saturation offline, so I'm taking it back on the concentrator. Level 2 throughput. No, Don, I need you not to do that. I'm so sorry, but I need you to stay strong, and we're working this together. We're working the problem, okay? That's what we're doing. We're working the problem. We've got this. And increase your throughput until everything else relaxes. Motorations, which are indications of more seizure activity when she's doing motorations, as she's appearing to do right now. We may not have had a full dose therapeutically of the midazolam. It's possible that she could be going into a second cluster set of tonic-clonics. So, fuck me, am I having a good day? No, 93% saturation, level 2 throughput. That's level 3. We're increasing it to level 4. Alright, that's helping there. Heart rate is at 60 BPMs. Okay, here's the deal. Unless it's urgent, you don't talk. Unless you're telling me a critical symptom, you don't talk. I don't want stories right now. Only focus is breathing. I need you to go long and deep. That's the girl. Good girl. We're going to beat this sucker together. Come on. You've got this. That's the girl. You've got this. I know you're tired, sweetie. You can rest later. Come on. You're doing so well, boo-boo. So well. Come on. Hey, it is working. You're doing all the work. That's brilliant. I'm going to bring you down a level here. You keep breathing. I'm bringing you down to level 3 throughput. You keep breathing like that for me. That's the girl. We're all working with it. Come on. That's it. Slow and deep. Come on. That's great respiration rate. Thank you so much. You're doing super well. Staying 97 static. Bring it down to level 2 throughput on the machine. Come on, same again. You don't stop. I know you're tired. Just go into relaxed normal breathing mode. I don't want you to feel stress or strain with this now. That was good. You did that for a good period. I appreciate that. Level 2 throughput. She's currently sitting at 96% saturation. Heart rate is at 66 BPM. Now it's quite likely with all the bowel medications and issues that she's been having, clearing her bowels out, the therapeutic levels of the epinephrine, the seizure medication that she's on a daily basis, have obviously flushed out. She's probably got a reduced low threshold with the therapeutic levels, and that's obviously exacerbated into more seizure activity, more frequency of seizure, and probably the duration. Because of the volume of fluid dispelling that she was doing during that particular episode, rather than aspirating and choking on it, she couldn't engage with the muscles around the dysphagia, so that was coming orally out. Now with that, obviously I'm giving oral medications, so probably we've lost some of the quality of therapeutically around those as well. This is where an IV or injectable would have been a better delivery method. Don't have that on hand to be able to provide. Pain is what she's dealing with currently. It's okay, pain's a good response. What's happening? Your neck sore? Right, well we'll be able to do something about the neck soon once everything else is over and over, okay? Diane's got CCI, craniocervical instability. 2 lots of impingements. She actually needs a cortisone injection of the neck sorted out.
I'm freezing.
You're freezing. It is a little bit on the colder side, I know.
I'm breathing.
You're breathing, yes. I'm sorry. You are breathing. You're breathing bloody well. Good girl. It's currently 7:45. Certainly been a prolonged episode with a few different things going on. Mixed mode neurology is something which we have to deal with on the regular. Which type of seizure is it going to be? Myoclonus, absent, atonic, tonic, tonic-clonic, focal, with or without impaired awareness. You take your pick. Any one of these things can happen. Sometimes multiple, sometimes one precluding onto the next. Don't take quite a lot of tonic-clonic seizure sets today. Dystonia, another neurological related condition, movement disorder. Tourette's, motor tics, also occurring and engaging, again, neurological offline behaviour. Orthostatically, heart rate going around. We already know about our heart's in failure. It's not doing well, and we are struggling. Currently at 94% saturation, oxygen level 93, and she's still running on a level 2 throughput. Hey, beautiful. Heart rate is at 61 BPM. You itchy? Are you hungry?
No.
No? It's good. You're not hungry. So what did you hurt during today's seizure? Can I have a bit of a rundown so I know? You had a seizure, sweetie. You had several seizures. You've had lots of dystonia. You've had lots of struggle breathing. You've had some heart problems as well. I know. Your oxygen levels were down to about 82% saturation for a period of time. We've got you back up, and I know you're still struggling. The dystonia I felt was through the back and through the abdominal wall. So it's in intercostal between your ribs. It was affecting your diaphragm, and your esophageal muscles were also engaged. So that's why you're having problems with swallowing. You're doing a lot of dribbling. Yes, your mouth was literally a tap. That's a good analogy. You were flooding through on the mouth. I absolutely agree on that. It was yucky. Okay, but that's okay. That's why we've got these, and we can change colour slips and sort that out. Your pyjamas are okay. No, they're your favourite pyjamas. I love the pink ones, actually. Peter Alexander, aren't they, these ones? They're your favourite? Well, I love you in pink. I think you look absolutely stunningly gorgeous. You've done really well. I know you're going to feel a bit tired. Look, I think it's mostly over. I can see the blepharospasm is releasing. I haven't seen any more oromandibular activity. You've got a bit of bunching, which is the last lot of clustered tightening around the forehead. Do you have any head pain, Diane? Just heavy. That's okay. Yeah, just across the frontalis. I can see that. Heavy. All right, you're doing so well. Well, you know what? Very soon. Yeah, you're going to, because today, unfortunately, you're tripped over. Today, you've had visitors. They didn't mean it. They were unscheduled. They didn't know about your pacing, and unfortunately, that set you off today because you got excited. Shower yesterday, absolutely. You had a lover seizure, dystonia, and Tourette's episode yesterday. I know, but we have to actually pace, okay? And we're seeking medical help. You know that. Settle down. I know you need help. I get it. So we're doing the best we can. So we'll continue that on Monday. Today is Sunday, but coming back on Monday, look, we'll be engaging with the health department and the hospital. We're trying to elucidate a urgent, I hate that word, fucking it does my head in, an urgent transfer from one hospital through to Royal Perth Hospital, where we're trying to centralise care. We're trying to get a new care team together. We're trying to get a team to cooperate and coordinate with Diane's GP, her primary care physician, as we stabilise and actually work through a lot of the treatment options which are available, because there are clinical guidelines for this condition 22q, international clinical guidelines, which Australia has actually been part of formally. But unfortunately, none of the doctors over here in WA have been part of that process. They aren't educated in it, they know nothing about the condition, and that's the problem with rare conditions. There are over 7,000 rare conditions. They affect about 2 million Australians, that's 8% of our Australian population, and out of that, only 5% have actually any treatment or care management plan in place, and that's not good enough. That's where research needs to increase. We need care centres for adults with these conditions. Creating care centres of excellence for children helps in the paediatric setting, but it doesn't allow the migration from adults to come back into access to those. We have 2 specialists for 22q for children, one at Perth Children's Hospital, one at Queensland Children's Hospital. Diane can't access, engage, get feedback, get support from those specialists because they're paediatric. The Medicare system in Australia doesn't allow you to go backwards. Bloody crazy, right? So she's under 24, 25 different specialists. None of them know the condition, and that's part of our educating and advocating as we work with them with the clinical guidelines that are available, readily available. There are medical journals which are peer reviewed, lots of information on this condition that's accessible. Now let's check in on her. 94% saturation, oxygen, heart rate is good and stable at 65 BPM, so I'm happy with that. Right, well, I'm going to try and do this. I'm going to turn the power off here. Alright, we're going to reboot you, and we're going to see if you sustain, but you need to focus not on talking, just on breathing. If you can do that for the next minute, then maybe I'll take this off you. Alright, we need to see that you're not going to drop back down again, Bubba. You've had enough of syncope. Dawn loses time during these episodes. She'll come back and go, wow, where did an hour and a half or wherever else just disappear? She won't be aware. It'll probably feel like 5 or 10 minutes for her. Time awareness is difficult enough when you've got autism and ADHD, but when you've got neurological things,
20 minutes for that.
I think we're approaching about an hour and 15 minutes from start, sweetie.
Oh
Yeah, I know, it's a pretty bad episode today, to be honest. Right, you're sustaining oxygen. Yay, yay, yay. So I'm going to do this. I'm going to take this off you. Cannula removed at 7:51 p.m. Now we're going to see how you go. I'm not going to totally put this away. I'm just going to have it on hand in case.
I don't want it.
You don't want it. I bet you don't want it. But for the moment, it has to stay close at hand in case I need to re-engage. No. You're done. I hope so too. Right, you're stabilising? It's 7:51 p.m. Are you wanting to go to bed? We can go to sleep if you want to. We were trying to watch Maths, Married at First Sight, and then you decided to do this just when it gets to the juicy part. You know, we're hanging on the edge of our seat. Those yawns keep coming. Diane loves, from the perspective of psychology, watching the interactions of Married at First Sight. Tomorrow I'm heading off to Murdoch University myself in the afternoon to meet with the team from the molecular therapy lab. That will also involve some video and photographic work as I am interviewed as part of Rare Day Awareness. I'll be talking about 22q. You need a... Sure, let's have a puppy. Why do you need a puppy?
We'll be lonely when you're gone, so I need a puppy.
Okay, I can't just magically get you a puppy. I'm sorry, it doesn't work like that. And then we go try and look after the puppy, and that's hard enough in an apartment. Bit of a challenge, isn't it? Though we would really love an assistance dog, support dog. That would be a fantastic idea for so many reasons. Seizure awareness, protecting you, early detection of POTS, exactly, calming effects for autism. There are so many benefits of actually having a service dog, but can you get one? No, through the NDS you can't. You've got to go on long wait lists to try and actually apply for these things, or have the money or fundraise, and we're not willing enough to doing fundraising. You were scared today? I'm not surprised. It was a pretty horrific episode. I'm so sorry, but we've got you. And of course, if I didn't feel good on the thresholds that I couldn't sustain you, then the first thing I'd be doing is ringing 000 and getting an ambulance here. I know, Bubba, but we can't get one. Okay, not at the moment. We don't have the funds to do so. I'm sorry.
I want to get out of the city.
I bet you do. I want to get out of the city too, but at the same time, we need to be centralised near hospitals until you're stabilised. So this is why we need the healthcare system to step up and actually do their damn job and actually learn about rare conditions. That's what the rare guidelines for Australia, the national recommendations for rare is the reach out to centres of excellence. Well, if the doctors don't have one for adults in Australia, then they need to branch further afield. Mayo Clinic, whatever happens to be overseas, there are plenty of clinics for 22q that exist. I want to live in the country too, and maybe we'll look towards doing that.
My doctor's retired in the country.
Okay, you can ask him. He can come down to the country with us too. All right, your levels are stabilised. I'm happy with that. What an episode. Now, all of us will get logged. All the clinical information we take from the watch that she wears. Sorry, Darren, just for the moment, the data on her pulse oximeter will go through from here into graphical data. So we record everything from oxygen and heart rates, blood pressure, temperatures, room temperatures. The Sammy 3 camera, which is this device up here, also is recording every single event and movement. Honey, about an hour and 20 minutes ago that went on as you were crashing. Yes, Maximus.
Oh, Maximus.
You get to have mum. Yeah. At least do something, Max. Come on. Got to work for it, buddy. Now, guys, if you're new to the channel, welcome. Don't forget to subscribe, hit the notification bell, do all those regular sort of things, comments, questions, ideas, and suggestions, leave them below. Big thumbs up, hype the channel, share. If you share, it helps us to create awareness, to share Diane's story dealing with rare. Our household is a medically complex household. Every hospital we go to, they say she is medically complex. Yeah, I get that. We know that. You guys need to help us through this process, right? We talk about carers stuff. We talk about the NDIS disability. We talk about the health system in Australia. Patient who's got autism, ADHD, OCD, Tourette's, all these other different things, Ehlers Danlos, you name it, okay? That's part of the conversations as well. Now, remember, we're not medical professionals, so we're not here to give you guidance, advice, direction, or diagnose or anything like that. That's not my job. That's not our job. That's what your primary care physician, GP, or specialist is for. So please go see them. Don't roll off the bed. That's a big, deep stretch and yawn.
Sorry.
That's okay. Just don't want you to roll off the bed, otherwise
My baby tabby.
he ran away.
No appreciation.
No appreciation at all.
Of the love.
Okay.
I wish I was as loved as him.
Yeah, I know, right? Cat's
Yeah,
life.
right.
All they are. We're servants to our cats. You realise that, don't
I
you?
need to-
You can see how she's trying to work on me. This is her first thought when she's coming out of a seizure.
I tried.
We need a dog. That is terrible, honey.
It was terrible, Mira.
It is terrible, Mirror. What movie is that from? I wonder. All right, guys, we're going to love you and leave you, and we will see you in another episode real soon. Bye for now.